month 3 of your pregnancy and you'll be able to hear your baby's heartbeat at your next prenatal checkup, if you haven't already. How big is my baby at 12 weeks? By now your baby weighs a full ½ ounce, with a crown to rump length of 2 to 2¼ inches, about the size of a lime. This week, baby's digestive system begins working. Most of your baby's systems are fully formed, though there's still plenty of maturing to do. The fetal digestive system is beginning to flex its muscles, literally, as it starts practicing contraction movements, a skill your little peanut will need after birth to push food through the digestive tract. The bone marrow is busy making white blood cells, weapons that will one day help your baby fight infection once she's out of your safe haven and in a regular play group. And the pituitary gland at the base of the brain has started producing the hormones that'll enable her to make babies of her own in a few decades or so. The end of some pregnancy symptoms. As you near the end of your first trimester, your uterus, now about the size of a large grapefruit, begins to migrate from the bottom of your pelvis to a front and center position in your abdomen. If you're lucky, this will bring an end to one pesky early pregnancy symptom, the constant urge to urinate. Also slated to diminish somewhat now that you're on the cusp of your second trimester are some of those other early pregnancy symptoms: nausea, super tender breasts and nipples, food aversions and fatigue. The start of some pregnancy symptoms. Once you hit your second trimester, there's a new pregnancy symptom that may be added to the mix: dizzy spells. And guess who's to blame? Yup, it's your old friend progesterone again, which causes your blood vessels to relax and widen around 12 weeks pregnant, increasing the flow of blood to your baby, again, good for baby, but slowing the return of blood to you, as always, not so good for mom. What that means for you is lower blood pressure and reduced blood flow throughout your body, including to your brain. These factors can contribute to that lightheaded, dizzy feeling, especially when you get up too quickly, which is why slow and steady wins the race here. Another cause of dizziness during pregnancy is low blood sugar levels, which can occur if you're not eating regularly. Low sex drive? Hormones hit every woman differently, meaning a spike in sex drive for some and a damper on it for others. Rest assured, whatever you're feeling is normal. Just stay emotionally connected with your partner and remember that many women have ups and downs in sex drive throughout pregnancy. Tips for you this week: embrace loose styles. Your doctor can feel your growing uterus by touching your abdomen, but your belly may not be sporting a bump. Until you're ready for maternity wear, shop for looser or stretchy clothes. Start doing Kegels. Pushing your baby through your pelvis and into the world is demanding not only on you, but also on your pelvic floor muscles, which have to stretch to proportions previously unimaginable. Doing pelvic floor exercises can ease pregnancy symptoms and lead to a faster post-birth recovery. Squeeze the pelvic floor muscles for up to 10 seconds, shooting for 3 sets of 20 a day. Building these bladder and uterus supporting muscles reduces your chance of bladder issues and eases a host of other pregnancy and postpartum symptoms. Steer clear of alcohol. The warning labels on the sides of beer, wine and alcohol bottles are there for a reason. Drinking alcoholic beverages during pregnancy can have serious consequences for your baby, including birth defects and complications. Rethink hair removal. Shaving might be a cinch right now, but as your pregnancy progresses, you might have trouble seeing below your belly or keeping your balance. Stay hydrated. Here's one bottle you need to be hitting: the water bottle. It's more important than ever to stay hydrated now, so plan on adding an extra glass of liquid for every half hour of activity. Stick to water when possible. Take in even more in warm weather or when you're just plain sweating a lot. Know which foods to avoid. Fortunately, you don't have to worry about finding unpasteurized milk at the supermarket, thanks to the Food and Drug Administration, FDA. But you can run across soft cheeses that have been made with unpasteurized milk, and those can harbor listeria and other pathogens. To stay safe, don't nosh on feta, brie, camembert, goat cheese, blue-veined cheeses and queso fresco unless you're positive they're made with pasteurized products. Always check the label to make sure. For a safer alternative, stick with hard cheeses, like Swiss and cheddar, or heat up soft cheeses until bubbly. If you got any value from this video, hit the subscribe button. Subscribe to the channel and don't ever forget, you know how to mom.